These are the voices of the writers of the 61 ABC. Thanks to everyone here who helped collect these cards. Just Harvest educates, empowers, and mobilizes people to eliminate hunger, poverty, and economic injustice in our communities. Weakening transit in the Mon Valley is unequal to justice. Far fewer residents own cars in the Mon Valley. There's an overall lack of accessible, fresh, healthy food. There are food deserts all over the Mon Valley. This change will make it much harder for residents to get to grocery stores as well as to work and medical care. For many residents in the Mon Valley, cutting their vital transit service frequency by nearly half can make the difference between keeping and losing their jobs, between keeping or losing childcare. Many riders are the service workers and customers that are the economic engines of Pittsburgh's largest employers. Transportation barriers are most clearly serious for those communities and groups of individuals that are most likely to experience poverty, including minorities, persons with disabilities, the chronically ill, the elderly, and households with children, as well as those low-wage workers who often must work 2 or more jobs in varied locations with multiple transfers in order to support the basic needs of themselves and their families. Paying an additional $2 in additional transfer fees for the Connect cards, if only one transfer is needed, or $5.50 for cash users, is prohibitively expensive for such households, and will also have significant impact on residents' access to safety net services and family support networks. Many Mon Valley riders already have to choose between vital needs such as food, medicine, utilities, and housing costs. People should not have to choose between food and a bus pass. So Allegheny County has studied this a lot. There are a lot of reports by the county itself, by the Department of Human Services, by the Allegheny County Health Department. The Urban Institute's report, Understanding Trends in Poverty in the Pittsburgh Metropolitan Region, identifies public transit as critical to increasing opportunities for low-income residents and communities to move out of poverty. It is the second most cited obstacle that people who are struggling face. 48% of providers reported that transportation was the biggest barrier for their clients. In 2014, this importance of transportation was highlighted by the Department of Human Services report, Suburban Poverty, Assessing Community Need Outside the Central City, and the Allegheny County Health Department identified transportation as one of the most critical social determinants of health. Listen to the people who have written on these cards. Thank you.